Hello everyone. Today we are going to talk about the mostly talked hot topic of lifestyle. Now, what do you mean by lifestyle? Let me hear the definition from you. Is it something to do with the standard of living? Or is it something to do with diet and exercise and how day to day routine activities are going on for you? And how is that important for diabetes? So let's take a look and see the perspective of diabetes and lifestyle. Now, I get a lot of busy IT professionals, businessmen, traveling all the time, and they tell me that they simply cannot stick to one diet. It's extremely difficult to manage anything like routine exercise regime. It simply doesn't exist, and they cannot physically fit into their routine lifestyle. Now, I ask you if you are someone in your 30s or 40s watching this video, this is for you. Now, I ask you, what happens to you in the next 10 to 15 years? Have you thought of this question as to how you see yourself in the next 15 years of your life in terms of your physical health? You probably haven't had a time or chance to think about it, have you? Now, this is now or never. Set your priorities now. You do invest money in your life insurance policy, don't you? Now, why can't you think about diet and exercise as a long term, lifelong prescription, which gives you healthy, bright future? So let's have a look at lifestyle and its diabetes link and perspective. So here is the first one. Everyone knows diet, big thing. So what is my diet like at the moment? Have you asked yourself, is it healthy? What do you mean by healthy lifestyle and healthy diet? So basically, diet in diabetes, there's so much out there, isn't it? We're going to have another video just specifically on diet because I am quite interested to suggest a low carb diet for my patients. And just not enough to suggest low carb diet, I'm exactly going to tell you what should your plate look like. Okay, so what exactly things that you should eat or can eat with, say, healthy breakfast or snacks in between meals? That's the biggest problem in our Indian population, isn't it? So, diet is a big thing. We always talk about balanced diet, so having lots of fruits and vegetables. But can you do that in your routine? How can you do that in your busy lifestyle? Socializing in parties. What about those lapses? How do you balance that? Next big thing, exercise. How many of you, be honest with yourself, get time to do 30 minutes of cardio 5 times a week? Combine that with resistant exercise. These are the guidelines. I'm not talking about my personal opinion, but these are the guidelines for not just diabetic, but anybody who wants to be fit and remain fit. So, how many of us actually do it? It's hard, isn't it? But again, think about that lifelong prescription and have a routine which actually you can see yourself doing. It's you, just simply you, who has to take the motivation to do it. Nobody else can do it on your behalf. So start now and maintain it and stick to it. So, how do you do that? So, basically, I generally advise my patients or I do it myself and I combine various exercise regimes. So, it's not monotonous, it's not boring. It's very hard to get motivation to get up and do it, isn't it? So have an exercise buddy or even somebody who you can accompany with. Either go for a brisk walk if you have arthritis or other problems, or you have a treadmill at home, then do that. But combine and have variety. Even dancing is a great exercise if you are into Zumba and these things. But do something. Something is better than nothing. Okay, so first is diet. Remember, you are what you eat. And second one is exercise. Now, always combine that with cardio and resistance exercise. So, resistance exercise has got a good evidence that it actually reduces the fat around the abdomen and visceral fat as well. So, it's a good idea to combine that. Now, third thing important is stop smoking if you smoke. That doesn't do any good to you, your diabetes, your heart, or your risk of stroke or paralysis attack in future. So smoking is complete no-no. So if you are an alcohol fan, you are allowed it in limits, and the limits are set by these associations and societies around the world. So it's about 20 to 25 units per week. And I would say be sensible about it and enjoy, but health comes first. So we've ticked diet, we've ticked exercise, we stop smoking, and we have alcohol in limits. What are we missing? Are we missing anything? So we are looking after our body, our physical health. Anything that we haven't mentioned? Very important aspect of us. You guessed it right. Mental health. Big thing. So, show me one person who says, I'm not under stress at all. Take a busy IT professional, take a doctor, or even a domestic worker, or anyone in any job professional or bank manager. Everyone is under stress. And what stress does to your body? We know that it's not just related to heart problems and blood pressure and diabetes, but at micro level, it actually induces some kind of inflammation, which is responsible for many autoimmune disorders, where you actually have antibodies against your own body cells and you develop many diseases, and that can include thyroid as well. So, stress is a big thing. And how much attention do we give to stress? We don't. We don't really look after our mental health at all. We don't see it as a mental health. That's the problem. We look after our physical health. We talk about diet, exercise all the time. But how many of us actually see, have I got anger issues? Have I got any issues tackling my work-life balance? What are my priorities? Why is it affecting my mental health? And what can I do about it? We don't. We don't even talk about it. We don't like to think about it. We are just too busy. But I would urge you, not just for diabetes, but for any health conditions, or even if you want to be physically fit and mentally fit over the next few years or decade, make sure that your mental health is well looked after. And how do we do that? Well, it's what works for you. So many people do yoga, meditation, and I would say it's what works for you. So personal choice. So if you are somebody who just likes to sit in silence for a couple of minutes, take those couple of minutes out of your busy day. It's worth it, trust me. So here is your lifestyle. If you want to be healthy and you look forward to a bright future and want to enjoy that with your family, your children, and see them growing up in a good health, tick all these boxes, you'll be fine. Thank you.